Welcome back, everybody. This is Burke from Focus Physical Therapy. So if you're a follower of the channel, or you've seen my other video on diagnosing knee injuries, you'll know that several days ago I injured my own knee. This is a quick update on how things are going, how accurate my diagnosis was, what I've been doing to manage this problem, and if you have a similar problem, some good recovery tips and suggestions. So stick around. So knee injuries are no fun, and this one was no exception. Even though my injury is very, very minor, I still felt pretty hobbled for a few days. First, let's review my diagnosis. I didn't have a trauma, and my pain came on suddenly after moving my knee and feeling my kneecap catch. I had pain in one very specific part just above my kneecap, and it hurt whether I was standing or not standing, so being on my feet didn't seem to make a difference. Although it was painful, I had full range of motion of my knee. I could straighten it fully and I could bend it fully, and both of those directions didn't cause any increased pain. Because muscle tendons cover bursas or cross them, activating my muscle definitely caused me to feel more soreness. But once I had my knee in a certain position and I just contracted my quadriceps muscle, I didn't have any increased pain, so I knew that my muscle itself and the tendon of the muscle was okay. All of this led me to conclude that somehow when I moved my kneecap pinched or caught either the bursa or the membrane of the knee joint itself, and possibly the little muscle that puts tension on that capsule called articularis genu. So what have I been doing to manage this? This pain is pretty superficial and easy to get my fingers on, so I started icing right away every 3 to 4 hours for about 15 to 20 minutes. In my practice, I love to use kinesiology tape, so I used a strip of tape to lift my kneecap and put a little slack on that joint and capsule area. If you'd like to know a few of my favorite ways to tape the knee joint, leave a comment in the comment section below. My pain and soreness really peaked by the afternoon of the second day, and that's pretty common with these kind of acute soft tissue injuries. So at that time I used an ACE wrap to just give my knee a little bit of support. For bursitis, don't wrap your knee too tightly. You're not trying to take over the job of the ligaments in this case. Just something that feels comfortable and gives you a little bit of positive compression. For exercise, I've been doing some calf pumps and circles just to keep my blood flow going. I've been doing some quad flickers. Those will help keep my quadriceps muscle activated and alive while I'm waiting for this injury to heal. I'm also doing range of motion regularly, every hour, probably 15 to 20 reps of just bending and straightening my knee. Because it still hurts to actively straighten my knee, I'm using my other foot as a prop under my painful side to lift my foot all the way to get it fully straight. I'm being careful with it going down steps, but otherwise I'm trying not to baby it and I'm trying to walk as normally as possible. Working on my balance while standing on that foot when I'm doing simple things around the house like brushing my teeth or washing dishes would also be a really good idea at this point. So how long should this take to heal? Because this injury came on suddenly, and I know what caused it, catching my kneecap when I went to straighten my knee, as long as I don't repeat that move, things should get better pretty quickly. By day 3, I'm already feeling about 30% better than I did yesterday at the worst of it. So things are moving in the right direction. Since this injury is not structural, it's soft tissue, and it's a pretty sensitive structure, on top of that, your body will let you know if you're doing something that's irritating to it. But otherwise, you do not need to baby your knee, and it's actually better to keep it moving. You'll recover much more quickly, and you'll lose less strength and balance and motor control while you're healing. This injury really is like biting the inside of your cheek. If you leave it alone long enough, the swelling will come down and the irritation and pain will diminish, and you should be just fine moving forward. To know when it's safe to progress, I'll be using a couple of simple benchmarks. One is just getting up and down from a chair. If I can do that without any added pain, I know I'm in good shape. The other will be climbing and descending stairs. If that's pain-free and no problem, then I should be good to go, and I can get back to running and cycling and hard efforts with my leg without any worries about further injury. Now, I was lucky because my injury is pretty straightforward. There are other cases, however, where the bursitis is complicated by other situations in your knee, or something's going on that looks like bursitis and really is something else, something medical, such as maybe an infection or other type of problem. If you feel you have this problem and it's not going away in a few days, you really do need to have your physical therapist or physio take a look at it, screen it for you, and make sure it's not something else. Well, that's all for today. Thanks so much for watching. If you have questions or comments, leave them in the comments section below. And if you have requests for other video ideas, how to evaluate or take care of different injuries, let me know. I'd love to help. As always, like and subscribe to stay up to speed on all of our latest content. Have a great day.